maganda, very aesthetic, and very gold.
So hi guys, this is Dr. Apostol. So I will be sharing with you this very interesting case. A case of a smile transformation through ceramics. So let's proceed. So this patient went to my clinic with a chief complaint of having this asymmetrical smile. She doesn't like the appearance, the color, the sizes of her smile. So she wanted to have it enhanced. And also, she wanted to have a whiter shade of teeth. And upon assessment, of course, that's very, very important. We found out that there are a lot of issues. Okay, we are looking at the health of the gums, and that's very important to consider. Also, we checked some cavities, and that's also important. So this is the smile of the patient. As you can see, it's a little bit gummy on the upper right quadrant. It's actually compromised. It's because of the gums. It's kind of inflamed. So upon thorough assessment, of course, we conducted an X-ray, picture, clinical exam. We checked the depth of the gums. It's a probing depth technique. We found out that there's minor, or should I say, gingivitis. It's kind of mild gingivitis. So is it really that a big concern? Yes and no. Yes, because it's health problem. No, because we can actually do something about it. So we did a thorough cleaning, a deep cleaning, to be able to remove all the calcular deposits stuck inside the gums. So after we did the deep cleaning, of course, the gums actually stabilized, and then we did crown lengthening. Okay, crown lengthening is a procedure wherein we remove a little bit of bone and the gums as well, to make sure that the appearance of the teeth would look a little bit longer than the usual. Okay, so in this type of treatment, it is also crucial because we are not just fixing the problem on the aesthetic part, but also the health. So my periodontist did this, of course. This is a collaboration project. It's not just me who is responsible in doing this very tricky case, because we have to make sure that once handling the patient is very well versed, and he has, or the doctor, the clinician should have the credential to do it. And that's very important because we are checking not just the gums per se, but as a whole, no, as the design, the health, and everything. So I'm always collaborating with my specialist, especially for this case. My periodontist is essential. So that is the before and after treatment. Okay, as you can see, it lengthens the whole teeth. It looks good. And after that, I made a direct composite design. So with direct composite design, I can play with the composite directly to the patient's teeth to be able to make sure that the design is bagay. It should be in harmony, you know, it should be in harmony with the face. And as you can see here, it's pretty good. She's happy even with the design pala. So she's satisfied, and I'm also happy na we were able to give that kind of design. So before this is one of the crucial steps now, before we proceed to like a bawas, the teeth preparation. smile design is very crucial because the amount of the teeth to be removed will also be dependent to the design that we made. Sometimes there will be almost no reduction because of the type of the design. So dapat binabagay if the profile is the profile thing, if there's something wrong with the cavities and everything, we have to consider all these things before we jump into preparation, because preparation, these are irreversible. Okay, irreversible means once I remove something in there, hindi ko na may babalik. Okay, I cannot replace the enamel. I cannot put back again the enamel, but I can replace it with a material that is way harder than enamel. But of course, may bawas na. That's why we have to be very strategic. We have to be very, very careful when we do our preparation. So, as you can see here, we have the cast with the ceramics in there. I chose Lithium Disilicate. Why Lithium Disilicate? The patient wants to have a natural looking, minimal reduction within enamel surface. I did not touch the dentine, the second layer of the teeth. So during the whole experience, there was no sensitivity. It's actually seamless because it's within that certain level enamel layer. Dun lang 0.8 millimeter reduction. It's very minimally invasive. So dito, as you can see here, the shade we chose for her is B1 High Translucent, that B1 HD. It's durable, it's beautiful, and it's predictable at the same time. Of course, we need to make sure that it's properly fit. Try-in is very important. Sometimes, when we do our designing, maganda. But there will be a little bit of changes when it comes to the ceramics. Why? It is important to note that the design that I made, and the design that the lab or my lab will have a little bit of differences. Although I check it, I am the one doing the final, the anatomy and everything before we glaze and put some characterization. And yet, there's still, of course, it should be better. The result should be better. So, yeah, try-in is important for us to gauge kung ito na ba. Is this the right ceramics? Is this the right design? And number one consideration when we do our try-in is the fit. Is it fit enough? Hindi ba ito mapapasukan? The problem with veneers sometimes, or even crowns, pag hindi natin, if I neglect that part, na hindi ko in-ensure na yung fit is like perfect or seamless, it can create micro leakage. The bacteria can easily proliferate inside. So, making sure that the fit is perfect. That's why fit is king. So we did a try-in. The patient liked it, and we took a photo just to make sure na okay, and then we finalized the cementation. It's called bonding, addition, cementation of the lithium disilicate to the natural structure of the teeth. It is a must to do it. Hindi siya pwedeng tinatemporary, okay? Because we need to make sure that the patient is parang secured whenever she, use it, functional and healthy and beautiful at the same time. So, as you can see here, the result is stunning. very beautiful. I mean, it blends well with the patient's face, in harmony with her skin tone, with the color of the eye, the sclera, and as well as the distribution. The gums, look at the gums, it's healthy. Health is wealth. It is very important. It is also important to note that the transition from the ceramic to the gums is very important, because if we neglect that part as well, it can cause gingivitis. And that's the reason why sometimes it will develop bad breath or halitosis. That's why we have to be very, very careful when we do this very technique sensitive treatment. As you can see here, recall is also important. Why? Because we need to check if there's any excess cement. Okay? If there's any parafunctional contacts, we have to remove, we have to reduce, we have to make sure that it should be in harmony with the bottom teeth. Hindi lang siya ganda, hindi lang siya maayos tingnan. Dapat wala na we have to remove all the excess cement in there just to make sure that it will not develop any gum problem, bite problem, to ensure longevity of the porcelain veneers. By using night guard, it will prevent from possible grinding, because if you have a new set of teeth, of course, your brain will not accept the fact that may bago. It requires time. So, sometimes, nag-grind. Okay? It will happen when you're asleep. So, if grinding will happen, there could be potential trauma to your veneers. So, that's why you have to wear night guard. And also, visiting your dentist every 6 months is a must for us to check if there's something wrong. Okay? It is as if like your natural teeth. Once you use, or once you're well adapted to the new sets of veneers, then it will act as if it's like your natural teeth. So, yun yung advantage ng veneers naman. And as you can see, the preparation, sobrang konti. It's not like aggressive, so you don't need to fear about it. Usually, when we do our veneers, we have like 7 to 10 days waiting period. Waiting period for the final. So, magta-temporization phase tayo. From preparation to temporary to final and recall. So, usually, around 3-4 visits and 7 to 10 days yung antayan natin. But we should never, ever consider na mamadaliin natin yung process. Why? Because this veneers, your veneers, these are investments. Okay? You have to make sure that it requires time for us to create beautiful teeth. It's actually a combination of the machine. We have a machine here at the clinic. It's called CAD/CAM machine. We have a prime scan here to scan the details of the teeth. And then we throw it dun sa lab namin here at the clinic just to create that framework. And then we layer it. We layer it with my technicians, and also the characterization, handmade pa rin yung finish. So we are ensuring that everything should be hand finished, handmade pa rin. Parang may human touch pa rin, not just the machine. So it's a combination just to make sure that everything should be seamless. So thank you guys for tuning in. I hope you get something out of this vlog. So I hope to see you soon for my next vlog. So that's it. Good day.